Yes. So when we are talking about understanding that uterus, which we definitely had in our previous session, so layers, understanding of the layer and completely kind of, this image is going to give you more clarity. So again, beautiful image, and you can see the uterus as well as you can see the cervix. All the structures are beautifully presented here. But very important image is this one. Which is going to give you clarity that how blood supply is very rich into the uterus. And so we have ovarian arteries, which is going to start piercing the uterus from the perimetrium layer, outer layer. And that is going to go and supply the perimetrium by bifurcating into arcuate arteries. That is going to now go more, pierce more inside into the myometrium, which is the kind of muscular, smooth muscle. And myometrium, that will be again supplied by the same arteries and so much of branches of that. And after that, more bifurcations, and that is going to go more deeper towards the basal layer of the endometrium. By this showing you this radial arteries and basal arteries, you can see into this image. And then these basal arteries are kind of open structure, just because they have to react under this effect of estrogen hormone, and they will create a functional layer, that which you can see in this image. So this functional layer will be created by this arterial supply, which is present there. So we need the whole uterus completely vascular. So it should have too much of, and very good, not too much, very good blood supply, which is going to, uterus is favorable for hatching the uh, embryo. So, or that cell. So it is very important image you can see. And the same area, placenta is going to form. This is also we discussed yesterday. And you can take a screenshot and just read it. This slide, please take a screenshot, that how this blood supply is going to go through perimetrium, myometrium, and then the basal layer of the endometrium, and then it is going to create the functional layer. And this is how this functional layer is kind of, as per the estrogen level, as I told you yesterday, that we need some thickness inside, thickness of that functional layer for better hatching of egg. So you can see that definitely this layer is going to keep developing, and it will be approximately up to that, 8 mm to 18 mm, that much of thickness, which is very good for the hatching. And if fertilization happens, there will be good environment inside the uterus, and definitely the embryo is going to be hatched by that area. And yes, we discussed that yesterday. So this is how, yes, placenta formed. And whatever this process is going on inside the uterus at the upper part or the lower part, this we are calling it as a site of the placenta. And always upper side of the uterus, if any hatching is happening there, or that kind of site development is going on up from the upper part, so that is always safer side as compared to the lower part, because you can understand the load, because as per the gravity, the weight of the baby will be always keep falling downward. So we don't want downward placenta. So that is not a kind of favorable placenta for the pregnancy. It can give some kind of complication. So always a good placenta is when it is coming out from the up. And this is what we can see through the images, ultrasonography images. Yes, placenta is going to keep shifting upside as the uterus will keep expanding. So throughout the pregnancy, uterus is going to expand upward. As per that, the placental site can go upside. But when we are talking about the low-lying placenta, so that can shift upward as per the growth of the uterus. But partial placenta previa and total placenta previa can be an issue, and they will be like no shifting upside. Why this happens? Why the placenta is kind of developing from the downward side, or this placenta previa is happening? There is no kind of or any cause, specific cause. But we can always think about that if something happens with the uterus and there is some damage to the uterus upper side, if there might be some fibroids, some polyps, it might be previous kind of pregnancy, there was a placenta from upside, so that side will be scarred, because whenever the placenta is going outside, so again healing is going on at that part. So whenever the healing happens at any part of our body, that can leave scar behind, or that scar can damage the tissues. So that site will not be favorable for the further pregnancies. So multiple deliveries in your multiple pregnancy in our life can also give us this thing. And as per the aging also, when we are like 30 years old, 35 years old, 40 years old, so that blood supply, our organ health can go down, isn't it? And even the blood circulation to that organ also can go down, and that can again start showing you some issues like fibroid, for some kind of external tissue formations can start happening inside, and that external tissue will behave like a obstruction into that area. Any multiple abortions, whenever we are having abortion, so you can always understand that abortion means you are taking the fetus outside. It means that already the placenta was developed. So once you are taking that, when we are having the abortions, so the baby has to go out, the fetus has to go out. So it means that particular site is going to go for healing and scarring. So that can also create some damage to the uterus. So we should try not to have multiple pregnancies if you don't want to get pregnant. So don't go for abortions unnecessarily. So it is always better to use contraceptions or kind of, those kind of, just take care of yourself. Unnecessarily do not damage your organ. Take care of, use the contraceptions. Don't let the pregnancy happen. So this is very important. That's why this emergency pills works very good, because they can stop you at the level of fertilization only. The placenta will not get formed. So 24 hours pills. So if I will also tell you that don't even go for that pills. It is better to use the condom. And the fertility window, do not get don't have sex when you are ovulating that particular week. So avoid sex having that particular week. So we just discussed everything yesterday up to here. And we also understood that yes, if the placenta previa happens, what can be the complications? And as a physio, what we should do if placenta previa happen. So definitely physiotherapy is important, very important, and certain exercises which is favorable for the female, but certain positions which we have to avoid. Okay, that will be increasing the intra-abdominal pressure and as well as gravity. So these two things we should avoid. And yes, we can give exercises into sideline position or avoid just standing and sitting, and we can give exercise in all other positions. Yes, so far up to here we understood. Today we are going to understand that what other problem can affect the pregnancy during this developmental phases when the baby is getting developed inside. So we have another important organ which we discussed yesterday, which is a cervix. So cervix is a lower part of the uterus. If we can say that it's a lower part of the uterus, or we can also count it as a different organ because it has a different, it is kind of a door. It is kind of closing all the time. It has a mucus. So you can understand if you have cervix, so cervix should have a good length. So approximately 3.5 to 4.5 centimeter length is, we are counting it as a good length of the cervix. And if the cervix is smaller than 3.5, we say that, oh, it is the smallest, the cervix size is small. So how it affect? You can understand that it is not going to affect into first trimester when the baby is not developing, but into the second trimester, when the baby is going to grow and baby is growing inside, it can definitely going to increase the weight inside the uterus. And as per that weight, as per the gravity, the weight can always be towards the lower part, isn't it? Towards the lower side of the uterus. Whenever I'm standing, I'm sitting, if I'm pregnant, so the weight of the baby will be downward as compared to in a lying position. So you can understand when the weight will, where the weight is going to fall directly, weight is going to fall directly over that internal os, isthmus. And if this, we want that cervix should have a good length, good size, as well as the mucus which is present inside the cervix, which is like a kind of, like a Fevicol. So that mucus adhesive kind of, things, chemicals. So that mucus should be completely closed. And the more the length of the cervix will be, the more the mucus will be, mucus plug will be there, isn't it? So you can understand the bigger size of the uterus will take more stress as compared to the smaller size of the cervix. If the cervix size is 4, so you can understand, yeah, it is lengthy cervix. So the weight, all the way, it can bear the weight of the baby, when the weight, the load of the baby. But if the size of the cervix will be smaller, might be during that further progression, when that baby will start getting bigger, 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 4th month, 5th month, 6th month, due to the further weight increase inside the uterus, there will be more load over that cervix, and it might open up the, it might kind of, it will not be sufficient to take the load of the baby because the size is not good. So this condition, we are calling it as a cervical incompetency, cervix or insufficiency. It means the cervix is not sufficient to take the load from the above. So you can understand that if you have a small mass, small neck, or you have a long neck, so same thing, long neck can take more load as compared to the small neck. So this condition can also happen during that particular time, and depending upon the size. Now, when we are saying, okay, it is kind of, and you can also see this image is a beautiful image, that 4 centimeter length, and if this length is 1.5 centimeter to 2.5 centimeter, so this is a kind of small, compressed. Anytime it might be, we don't know how it is going to behave, and how it will react as per the more loading when it is coming on that. So this kind of cervix can open up automatically, and if it will open up, there is high chances of miscarriages. So this is again a problem. We are calling it as a cervical insufficiency or cervical incompetency. So in this image, you can see that cervix is having, this endocervical part is having this mucus plug, and we should have the closed cervix all the time, not the open cervix. So that if the size will be smaller, load might be not be able to take. When the load will not be taken care by this cervix, this plug which is pressed, the mucus which is there, mucus plug, that might start thinning due to the more pressure. And if it will thin out, so you can understand that baby will slip out. So we don't want that. So baby is only like into 4th month or 5th month, isn't it? So it is very, very important that this condition we also understand as a physio. In our book, it is written that physiotherapy is contraindicated in incompetent cervix. Yes, it is same like placenta previa. So in placenta previa, there was a pressure over the placental side, but in this one, the pressure is over that cervix. And cervix is not good enough or strong enough to take that load. Okay. So this can happen, and we have to be very careful in this case also. What the doctors are doing when they will find out that patient is having, how the patient is going to find out about this through the USG reports. So what is the size of that cervix? So that will be there. So whenever your patient comes to you, so always see that where is from where the placenta is coming, what is the side of placenta, and the second is we have to see what is the size of cervix. If the size of cervix is like 3.5, 3.8, 4, 4.5, good to go, no issue, you are safe. But if the size is smaller, so we have to be more careful, okay, by in giving the positions. So in this case, we cannot give her positions sitting and standing, the loading directly over the cervix. So unloading positions will be that good positions if we are giving exercises. In books, it is written that no physiotherapy or it is contraindicated, but no, we have to give her exercise because the female will be onto the bed. Doctors are going to do this procedure with them. We are calling it as a cerclage position, cervical cerclage, and cervical cerclage correction of the cervix. What they are going to do in this, just to prevent this premature birthing, because as per the baby growth, there might be opening and baby can sleep outside. It can happen into fourth month, fifth month. In this case, baby can't survive, and it can also happens during the third trimester into up to seventh month also. So in this case, premature baby can also, premature birthing can also happens. So we don't know when it is going to happen with the female. So doctors are taking extra care by giving this cerclage procedure. So they are doing a suturing, stitching. They are applying the stitching around that cervix. So they will do the stitching and they will tell the female, it means the clamping of the cervix. You can see in these images. And after this cerclage banding, they will tell the female that, oh, what they have to do now here, no pressure from the upside. So complete bed rest. So lie down and unload the cervix. So means lie down on the bed and avoid the gravity positions. Okay, so that is another thing which we should be always careful as a physio, and we should always check the position of the cervix, the length of the cervix, and if cervical cerclage has even the if the female is coming to you in third month, so be like take extra care into third month and fourth month. It is a very initial time period. Normally, the females will not come to you in first trimester, but they will start coming to you into second trimester, from the second trimester onward, when everything will be settled down. So, but if they are coming into first trimester, please go through the USG reports, and as per the reports, just start your positions and your exercises, which is important for the female. Okay? So that is again a position which we have to be careful. And yes, assume that everything is fine. If the things are not fine, if it is a kind of placenta previa, it found and you found, or this cervical cerclage you found. So now we understood that we need home care. We have to go to the house and give her a physiotherapy at home. All the exercise you can plan at her home. But if everything is fine, then yes, what is going on? So let's just understand that as soon as that pregnancy happens, pregnancy means that implantation of the fetus happens and placenta will form. So what is the first thing which is going to happen in our body? As a woman, the first thing is a placental development. So means the connection between the mother and the baby. So now here we need to understand one thing, that as soon as this placenta start developing, so what is the placenta? Placenta is again, we can assume it like a new organ is forming inside the female body. With this organ is going to help and support baby and child growth, baby growth. Now this is a new organ, and this new organ is kind of, you can see in this image, yes, this, it looks like a new organ, isn't it? Oh, yeah, it looks like a new organ here. Yeah, this is a new organ, like this. So this, as soon as this placenta, so placenta is going to develop bigger throughout the gestational time period. So now, once it is starting developing, and assume that female had her fertility on 14th day or 15th day of her, at the day of her ovulation. So we can assume that it was 15th, okay, 15th day. And then from 15 to within 6 days, the fertilized embryo came into the uterus. So within 21 day of her period cycle, 21 day or 22 day, the placenta, there will be merging of mother cells in the baby cells. So the placenta will start forming. So this is the time when the size of the placenta will be very minute, isn't it? Because it is start developing new cells. So this will be minute. And slowly, as the days will pass, the size of the placenta is going to get bigger, because and the new connections, so many new arteries are going to form into this particular network. So it will be network of veins and the networks of the arteries, because they have to supply the baby and they have to take out the excretory system also from the baby. So this kind of connection will be start building up and will keep growing, and the placenta itself, the organ, will be bigger into size. So up to, you can understand that up to 10 centimeter in a circle, that much of width it will require up to the ninth month. And during that, if you have seen the placenta after the childbirth, it will be kind of a big organ. So that is going to go through the slowly developmental phases. Now, as this small cells start forming, so now what physiological changes are happening into my body inside? So it is very important to understand that body physiology. Okay, so as soon as this placenta form, so placenta will behave like the small organ which is going to develop. The small organ is going to behave like a new gland. So this is going to secrete very important hormones, which is going to facilitate the pregnancy further. So we understood here that this functional layer was adhere with that basal layer due to the progesterone hormone. And that progesterone hormone was coming up from corpus luteum. And corpus luteum was that cell which was left over after ovulation. And I already told you that corpus luteum can survive up to 14 days. After within like no after 14 days or 12, after 12 to 14 days, it is going to get shrink out. Once this corpus luteum will shrink out, so there will be no progesterone. And if there will be no progesterone, so this adhesion between the functional layer and the basal layer will not happen. This is what is happening during the periods, that how the periods are, this layer is shedding outside because there is no progesterone at that time. So if we really required progesterone to sustain the pregnancy for 9 months, but the progesterone which we were getting, it was coming from the corpus luteum, and the corpus luteum is going to die within the 14 days. Now, who is going to sustain the progesterone level in our body? So that progesterone, that responsibility is going to taken care by the placenta. Placenta will become a new gland and it will start secreting progesterone. So progesterone level will not go down. The more bigger throughout the pregnancy, the more bigger that placenta, the more bigger you can say that more amount of progesterone will be there in a female body. So to sustain the pregnancy and to sustain that adhesions, the connections between a mother body and the baby body, we need a progesterone hormone. And that progesterone hormone will be given by the placenta. We can also understand that in initial time period, because this organ is very tiny, very small, so that might not be sufficient in some cases. That's why doctors are giving injections of progestin. So just to sustain the optimum level of the progesterone as per the requirement of that internal uterus. So sometimes it is given to the female and sometimes the body is sufficient. The placenta itself is sufficient to supply that. Mostly it is sufficient to supply that progesterone level. It will keep increasing into size. It will keep secreting the progesterone level. So it means new gland is formed in our body. So now what is the first physiological change which happen in our body? That change is a new formation of the organ. So glandular, it's kind of, you can see in this image that what will be the endocrinal system change. So we have so many systems. What we have respiratory system, gastrointestinal. We all know about this. So now out of this system, the first systemic change which is happening, which is taking place, is an endocrinal system change. Why? Because that glands are taking responsibility to secrete different hormones, which is responsible for the pregnancy, sustaining the pregnancy, sustaining the baby growth. So the first hormone which will be there, the first change which will be there will be into the endocrinal system change. So once endocrinal system change, yes, now you can understand, if I'm a female, I'm not a pregnant, and a female who's a pregnant, so my hypothalamus because I'm not pregnant, my hypothalamus is secreting GnRH. It is secreting GnRH is triggering the pituitary gland. Pituitary gland is secreting that follicular stimulating hormone. That hormone is going to the ovary, and ovary is developing the egg. So, and the egg will, the more egg will develop, estrogen will start coming into the body. So this is a normal cycle going on in a non-pregnant woman's life. But here, already there was an ovulated egg, fertilization also happened, already the placenta has developed. So body achieved its reproductive stage. So now in this case, the system is going to now shift here. What will happen? The first hypothalamus was secreting GnRH. Now it will not secrete GnRH. It will stop secreting the GnRH. So now there will be no chemical release into the body, which is triggering the pituitary gland to secrete FSH. So now pituitary will not secrete follicular stimulating hormone. What is the follicles? Egg. So the pituitary will not secrete that chemical into the body, which is going to stimulate the egg, because already the egg is fertilized. So we have to stop that process. So the pituitary will not secrete FSH. So that is a kind of seizing one side. It is some kind of, you can say that seizing process is going on. Pause, body is under the pause. No, don't develop the new egg, because already fertilization has happened. So now new process is going to happen into the female body. In this case, when pituitary will not secrete this hormone, FSH or LH, pituitary will start secreting a new hormone, and which is requirement of the body. That hormone is a prolactin hormone. So prolactin hormone is going to start, what it is going to do? It is going to prepare the female new glands. We have a mammary glands present. So other system are mammary glands. So they have to be active. So this prolactin hormone is going to create, make the mammary gland active. So they're already there, but they will be more active. So that is that new change is going to happen, new hormone, which is going to act onto the mammary gland. So breast size. So as soon as this placenta will be formed, so you can understand that systemic change, endocrinal systemic changes will be there, and we can observe the breast change in a female body. So within 1 month, so 21 day, this fertilization happened. Within some time, within 1 month, breast will start getting more tender and increase into the size. So the nipples will be more protruded, the areola will become more bigger, that will be more darker into color, and the size of that breast will start getting increasing. It means the development is going on. The same thing will happen here, which was happening during the puberty time period, because during that time also this prolactin came to develop the eggs. Now over here, it is the further development, functional. The eggs will become functional. They're already developed, but they will become functional. They will become active. So this change is the first change, memory endocrinal system change, means glandular system change, new hormones. Another thing is that, okay, if this development is going on, you can see that placenta and the connection between mother and body. So who is connecting? The nerves, the veins, the arteries, the blood supply. We need to give blood supply to this new fetus or this embryo, so the embryo can develop. We have to provide the nutrition. So now which system is getting changed into this particular stage? This system is a cardiovascular system. Our heart, the another thing is, first is the endocrinal system change, because as soon as the placenta formed, so that is one system. And the second is, even for making this endocrinal system more active or develop, we need blood. So our our cardiovascular system has to now react, and the physiology of that system is going to increase. So now my cardiovascular health is sufficient for my body, but new body is forming. So my cardiovascular health system has to increase. It has to change. So now over here, who is forming? Arteries are forming, new arteries. And these new arteries are going to take, and the veins, they are going to take the blood towards the baby for the nutrition. We have to provide that. So now this kind of new network, it means heart has to do more work. So cardiovascular system change is happening here. So now not even that cardiovascular system change, even our, this is a smooth muscle, our cardiac muscles, they are the smooth muscles. So now my heart is sufficient for my body, but now the demand of the body is increased. Now in this case, just to meet the demand of that body, the size of the heart is going to increase. So it will be, might be surprise for all of you, but our heart size will somewhere, it will be more relaxed. So as compared to before, so the muscles, the cardiac muscle or the smooth muscles of the heart, they will be more relaxed muscles. And you can also see that we have this arteries which is going on towards that uterus with the somatic arteries, isn't it, which we just saw. So those arteries will be, there will be even no new formation of those arteries. So you can understand here that there will be more a kind of blood rush we need. And for just to meet that demand, this even the capillaries will start dilating. So they will dilate into size. So new capillaries are also forming. Even the dilation of the capillaries are also going on because we need to supply a lot of blood towards that area. So all the capillaries which is there, they will start dilating. And that's why we can meet the demand and we can form the new organ very fast. So this is what the systemic changes are happening here. Now, in this case, you can also understand that more blood rush will be towards the uterus because new organ is forming there. So now as a physio, can we understand here another thing that is giving her exercise, like you giving her exercise for upper limb, lower limb, is it good to give her? The answer will be no. Why to take the blood away from the uterus? Let the body do whatever it is the need of the body. So we should try to take this phase very slowly, first month or second month, because system is changing. And in this case, you can understand even the blood will not go up towards that, sometimes towards the brain. And this can give dizziness to the female. And she might have a fainting also. You might have seen that or heard that there's a kind of fainting happens, or she might fall out. So you can understand lack of oxygen supply. So lack of the blood circulation, or it will be slow down the blood circulation because the body is more sending the blood towards the uterus and new arteries are getting formed. So this is a cardiac system changes are going on. And you can understand that new capillaries are forming, and when the blood is, they are taking the blood, they are going to take the they are going to take that oxygen also with the blood, isn't it? And this oxygen is requirement of the fetus. And after that, it means so more blood, more requirement of the oxygen. It means our respiratory system also has to shift. So my lungs are sufficient for my body, my health. But if I'm pregnant, there's a double demand and new organ is forming up, more blood is going on. So now we need more oxygen. So for just to meet that demand, our lungs are also going to get kind of relaxed or enlarged into size. It will become bigger into size just to uh, meet the demand. So vital capacity is going to even increase during that particular time period, during that throughout the pregnancy. So you can understand that yes, my lungs has to do more kind of oxygen consumption. So you can see the third thing here, the breathing. So there might be shortness of breath female can feel, and kind of fast breathing she might have to do because lungs needs to do more work here. So this is going to give us another clarity that breathing exercises and inhaling is crucial for the female, and there should not be any tension into the pectoral muscle or any tension over the abdominal diaphragm muscle, because the abdominal diaphragm is the primary muscle for the breathing. So we want that this muscle should be more functional, so that breathing should be a part of our preconceptional physio care. So the female should, there should not be a kind of a shallow breathing, there should be a good breathing. And so that she can have she can just avoid that shortness of breath. throughout the pregnancy. We know that in first trimester, the baby is not growing up and uterus is not growing up and uterus is not compressing the diaphragm. But we are understanding that once the uterus will start developing into fourth month, fifth month, sixth month, it will go, it will touch the xiphoid, it will even start compressing the diaphragm from the downward side. So we don't want unnecessarily restricted diaphragm or unnecessarily restricted breathing pattern in a female. So it is very important that we as a female, we as a women should have a good respiratory system and good breathe in, breathe out. So that breathing exercises are very, very important throughout the pregnancy. And another thing is you can understand that, yes, there will be breast development. So the more the breast will develop, the more the pressure is going to happen over the chest muscle. Pectorals will be kind of tensed due to the loaded. It will be not tensed, it will be kind of loaded. So breast pressure is going to put pressure over the pectoral muscle. That can also affect her breathing. Okay, so that is also very important that we have to give her a pectoral stretch during the pregnancy, but not over here into first month, but it is going to give us clarity that yes, this thing is going to happen in a during pregnancy. Okay, so cardiovascular system is changing, the heart, the new veins, dilation, that is going to come into picture. That will take more oxygen. It means the respiratory system is also going to change. So we need a better breathing throughout the pregnancy, and it is very important to have a good giving her breathing exercises. I will share one video with all of you. It is around 2 to 3 hours video, so you can understand the breathing pattern, and you can just practice also with yourself. So yes, these are the two systems, and you can understand the breast are also developing, and then there will be further. You can feel here that if the blood is going and new arteries are getting filled up, blood is taking nutrition, oxygen is going, so there will be excretory system changes also is the requirement of the body, because the baby is growing, so that is going to secrete some excretion. There will be excretion from that through the placenta, and that excretion is going to go and is going to affect our urinary system or our kind of digestive system, urinary system specifically here. So now to just to meet that demand, our urinary system is also going to go for a change. And once that is happening, we can understand that in further cases, when the baby will start growing, there will be specifically growth of the uterus, and due to that, there will be change into that fascia or abdominal muscles or pelvic floor muscles. There will be muscular changes is also going to come in our body. So muscular changes is again a physiological change which is going to happen, which is going to start from the fourth month, second trimester. And not only that, muscular, so the muscles like the abdominal muscles will come into picture first. So pectorals will come into picture here, because this there will be expansion of that thoracic cage. So we need that there will be more stretching over of those muscles, and we need a stretching and kind of relaxation of the muscles, as well as even into the third trimester, there will be changes into the bone cavity, the pelvic bone, because just to accommodate the bigger size of the baby and bigger size of the uterus, there will be changes into the skeletal system, like our pelvic bone. So that is also going to happen. And when that changes is going on over the abdominal muscles or the pelvic floor muscles, so you can understand we have a skin, subcutaneous tissues, that also has to go for a stretching. There will be effect over the skin and as well as over the the kind of tissue thinning actually. So all the tissue will start stretch out just to accommodate the baby. So the core, specifically we can say here the core. So core is going to affect. So this is there are so many things, and you can also understand that other systemic changes to the as per the vascular health. So even into the feet, even hands, there might be, because the dilation of the veins and dilation of the arteries and dilation of the veins is going on just to supply the baby. You can understand that there can be edema happening into the feet or into that the whole body of the female. So these are the kind of physiological changes which is going to happen. But let me explain you. So this is a kind of overview, but I want you to have a more clarity that what is happening into the first system. We are calling it as an endocrinal system. So which hormone comes first? What happens first? Now, the first is as soon as you might have seen, or we are all aware actually, that as soon as we are pregnant, or if we feel that, oh, I had sex on, like I had sex and I want to just check if I'm pregnant or not. So we are having this a test doing, isn't it? So we have this pregnancy kit and we can just have urinate on that kit, and you can, there's one line or there's a two line. So if two lines, they are confirming the pregnancy. Now, what is there into that two lines, which is confirming that pregnancy? That is a hormone which is there in our urine. So as soon as the placenta will be formed, or the not the placenta, that cell multiplication, the fertilization. So as soon as that fertilization will be there and the placenta will be also there, the both is going to secrete HCG hormone. So HCG hormone is only present when the fertilization process has happened or when the placenta is there. If the placenta will not there, HCG level will not come into the urine. So we also call it as a human chorionic gonadotropin hormone. So that hormone is only during the pregnancy time period. It is made almost throughout, mostly from the placenta. If the placenta is there, this hormone will come. If the placenta is not there, this hormone will not. HCG hormone level found in the mother blood and urine, and which is going to keep rising, and that will be more rise into the first trimester, which we can see. And this hormone will, if the level of this hormone is more suddenly, so the female can have sudden nausea and vomiting, uh, which can be noticed into first trimester itself. So this is a hormone which is responsible from behind that pregnancy test. If this pregnancy test is negative, it means there is no placenta. Second is human placental lactogenic. So this hormone is again going to come from the placenta, and this is responsible for that all the nutrition supply which is going on towards that area. It is going to even stimulate that milk glands into that breast. So breast development. So it is also responsible for the breast development. So HPL hormone. So that is again itself is telling P means placental hormone. So and lactogenic, it means the placenta is secreting that kind of hormone which is going to affect the mammary gland of a female. So as soon as the placenta will be formed, so there will be more effect is going to go, the hormone is going to affect the mammary gland. So the mammary gland will be under two effect. One is the effect coming from the pituitary gland, so that will be prolactin hormone secretion, and one will come from the placenta. So the more growth suddenly we can observe in a female mammary glands. Now here, this placenta, we know that estrogen was there and estrogen was coming out from the developing eggs, and estrogen was something which was maintaining the uh, this function layer level, isn't it? The function layer which was formed inside that endometrium. So that functional layer should be there. We don't want that this endometrial layer is not there. So we want a good endometrial layer, and that endometrial layer should be sustained throughout the pregnancy. We don't want any bleeding, any menstruation happening during the pregnancy. So just to keep increasing that, the body requires estrogen. And estrogen was coming up from the developing egg, but now the eggs are not developing because already the FSH secretion there's a seizing going on into the body. Now, who is going to give this estrogen hormone? Placenta. Placenta will be that gland which is going to even start secreting estrogen, more level of estrogen during that stage, and which is going to maintain throughout the pregnancy, that the layer will not shed out and there will be no bleeding. We don't want bleeding. We don't want periods. So that will be maintained due to the increased level of estrogen in a female. Another thing is the progesterone. So again, this hormone was formed by the corpus luteum, but now placenta is here, and placenta will take care of that. And this placenta is going to keep increasing. So that will keep secreting the progesterone hormone, and progesterone will be is again the very important hormone for pregnancy, just to keep everything intact. We don't want bleeding, isn't it? Because when why the period happens, the level of estrogen and progesterone fall down. The moment they will fall down, the functional layer will start shedding out. So it means we don't want the shedding of the functional layer. So we need high level of estrogen and progesterone, and that will be taken care by the placenta. Now you can see that this gland is keep increasing, keep developing, isn't it? So more development can give you more hormones. It might be suddenly increase of the progesterone and sudden increase of estrogen. So too much of hormones in a female body, and that can give sudden change into the whole body physiology internally, as well as the changes into the sign and symptoms you can also observe in a female. Estrogen and progesterone are increasing the blood flow towards all the mucous membrane of the body, and that is also can show you the more estrogen, more progesterone can show the swelling of this the kind of what we are calling it's a mucous membrane. So wherever we are having mucous membrane, they will start getting swollen. So now here in the reproductive system, which area we have a mucous membrane? So we have this mucous membrane into cervix. So cervix is having this mucus plug. So this mucus plug, due to the progesterone and estrogen high level, that will start getting swollen up. So you can understand more swelling going on. It means the more closing or more thickening of that mucus plug. So because pregnancy is happening inside this room, so we don't want the entry. So there will be kind of more tension and tightness or more swelling into that door, cervix. So the cervical mucus will become kind of more protective and more swollen up. And same thing is going to happen inside the vagina also. So vagina is a kind of tube, and into that tube, we have a mucus membrane. So the mucus membrane will start getting again swollen up, and vaginal, all the circular side, completely circumferential, there will be swelling inside the vagina. So, and we want that swelling, that kind of change, because we don't want any bacteria, any pathogen to enter inside and unnecessarily develop any changes to any kind of destruction and damage to that area, and infections. We don't want that. So vagina will again start kind of closing. Not only that, vagina, you can say that outside we have the vestibular area outside as a female. So the vestibule is a pinkish area, no? Like this lips, we have these lips. So that kind of pinkish area. Now there also, that area will also go for swelling, and it will be more swollen up as compared to the normal female. If you see that vulva of a female who is pregnant, or the vestibule of a female who is pregnant, you will feel that it is more swollen up vulva as compared. So now this swelling is a kind of closing action. Body wants to close. Body don't want anything. There's no welcoming. So I don't want anything to come closer to me. So that's why we are also telling here that even we should avoid sexual intercourse also. So no penetration of the finger, no penetration of any sexual organ inside. Already the body and internal physiology is closing, swelling is going on into that reproductive tract, downward reproductive tract, because they want to have a safe uterus environment. So uterus, because baby is going to develop there. So the cervix will be closed, vagina will be closed. Now vestibule will be also swollen up. Even the vulva will be more fuller in that case. You will see the vulva of a female, it will be more full up and kind of swollen up vulva, you will feel. And another thing is, you can understand that when this is going on, the kind of swelling, so it is kind of more reddish into color, pinkish, reddish, purplish, that kind of color change we can observe around that vulva of a female. And this is what we are calling it as a Chadwick sign, that female has a purplish vulva uh, as a kind of Chadwick sign is present. Okay, so this kind of systemic change, everything is closed. Please don't enter because process is going on inside the uterus, and body is achieving it's already reproduction started of a baby. So that is very important. Now, so this is a kind of systemic change. Another thing very, very important here, which is going to another hormone, which is the requirement of the pregnancy, is because you can understand that the cardiovascular system change, there will be respiratory system change, there will be excretory system change. So now everything has to do double work. The cardiac muscles will relax, lungs will relax, even the kidney will be larger into size. So if this is the size of the kidney, it will become uh, like double than the size. So kidney size is going to get bigger also, because it has to meet the demand of that excretion which is coming out from the baby. So that much of things are going on. So we need even the uterus is going to relax. So the whole organ internally, their size is increasing just to increase the size of so who is going to increase the size? Who is going to create a soothing of that organ? So relaxing hormone. We need this hormone, and with the name of the hormone itself is a relaxing hormone. This hormone will start coming out from the placenta, and this will relax this system. So the cardiac will relax, the new arteries will form, the dilation will happen into the arteries and veins. There will be the relaxation of the lungs, relaxation of the uterus, relaxation of the bladder, kidney, urethra, everything will be, all the internal organs will start relaxing more. The size will increase because they have to do more function now. So they need to be ready for that. This is same like that if any guest is coming at our home, how we are preparing a new room, how we are preparing our house for the guest. So same way the body is preparing the whole body, every room for the baby. So this for this systemic change, this relaxation, this hormone is required, relaxing hormone. And this hormone will come and will start relaxing whenever whatever is needs to relax. So in a first trimester, in first month, what needs to relax? That cardiac system. So that changes is going to happen. Respiratory system. In second and third trimester, renal system. From there, it will start renal system relaxation. From the third and fourth trimester, uterus needs to relax. In fourth and fifth trimester, when uterus is relaxing, so we need a space inside that area. So you can understand the abdominal muscle, rectus abdominis, obliques, all the muscles which is over that uterus, they need to relax. So muscles needs to relax. When the baby will start growing, the load is going to fall over the pelvic floor. So we don't want tensed pelvic floor. Due to the loading, we need relaxation downwards there. So pelvic floor is going to relax as well. So, and we can also understand that pelvic floor is a downward muscles, through that baby is going to come outside. So we need a complete relaxed pelvic floor. We don't want tight pelvic floor. So there will be more role of that relaxing hormone during the labor over the pelvic floor muscles. That particular time period, this relaxing hormone is going to relax the pelvic floor. So starting from that first month, every month, new demand of the body, as new relaxation, every system is required. And just to meet that demand, this relaxing hormone will keep relaxing that particular system. Now, is the relaxing hormone is only one type of relaxing? No. Relaxing hormone has a kind of so many types. It is more than 20 types of different relaxing hormone which is there, which is going to come into that throughout the pregnancy, even after postnatal phase also. So relaxing hormone is going to relax the body so the baby can grow, and all the need can be met. And even after the childbirth, the relaxing hormone will become the healer hormone, and that is going to heal up all the organ, and every organ is going to come back in its normal position, only is also because of the relaxing hormone. So this hormone is very, very important. It is going to play a very big role, an important role. Without this hormone, the body cannot relax, uterus cannot relax, the heart cannot relax, and baby cannot develop. So this hormone is again a crucial hormone, which is coming from that placenta. So how beautiful the placenta is, the new gland is. Okay. And another thing is a cortisol level is also going to increase here, and you can understand that our ovary. So ovary has two functions. One is developing of the egg, and the second is secretion of the hormones. So the hormone which is coming from the ovary is the important hormone, is the androgen. And this androgen hormone, because now there is no development of egg is going on from the ovary, so ovary will keep developing the androgen level, secretion of the androgen, and that is going to increase the fat storing capacity of a female body, because I need to store the fat. So that hormone is the requirement of the body, which can take extra fat out of the food we are eating. So whatever food we are eating, whatever level of fat is there into that food, body will start storing that food because that is a requirement. And we don't know when we need that energy, because the energy, the source of energy is the fat. Whatever amount of fat is there, that is we are going to utilize as the energy. And that energy we need to develop a baby. So for the development of the baby, we need energy spent, and the energy spent is going to come from the fat and or for the from the nutrition, isn't it? So that is very important. So body has a beautiful phenomena that it will start preparing itself for adding extra fat. That's why weight gain is again very common during the pregnancy. Not only the weight gain, fat gain is very common during the pregnancy. A female is more having that type of hormone which will increase the fat level, which will store the fat. All the areas wherever we have fat cells like hips, thighs, glutes, every area or abdominal, there will be kind of fat storing start happening. Okay. Yes, we know that this is the breast. If you see the breast, we have in one each breast, we have a like we understand that mammary gland is active. They are going to get kind of functional. Okay, already the things are there. That things, that organs, internal structure was built up during the puberty time period, but that system was not active. It is not. What is this? What is the function of that mammary gland? Secretion of the milk when we need milk, when the baby will be there, and when the placenta is going to form the baby. So now the moment the placenta will be there, body know that very soon the baby is going to come into the picture and baby needs this milk. So body, this mammary glands will start, what is the function of every gland? Secretion of some kind of liquid. So now what is the secretion of the liquid which is coming from the breast? Milk. And is the milk is coming all the time? No, it is not coming all the time. It will only come when the placenta will make it active. And when certain hormones will come after the postnatal time period. Otherwise, there will be no secretion from that breast. Now, inside the breast, if you see that there are so many, doesn't matter what is the size of the breast, small or big, whatever size of the breast is there, but we have so many lobules present, so many alveoli, we can say, is present inside that area. Now, into that particularly, you can understand that, okay, so this is the breast, we have this nipple, we have areola, then we have this skin. So this is externally we can see. If you can remove that, we have fat cells inside that. So this is all fat internally, which is present. And then you can say these are the lobules. These are the lobules. Okay, so we have approximately 10 to 15 lobule in each breast. So some female can have 10, some can have 11, 12, 13, 14. Every female can have a different lobules. So these are the different lobules are present, 10 to 15. And inside these lobules, if you just cross-section that and you will try to look more inside, there will be kind of tree-like structure. We are calling it as a alveoli. So these alveoli are not functional. They are present, these structures are present, but they are not functional. These alveoli are going to get functional when the prolactin release will be there and when those kind of hormones will come from the placenta, which is going to stimulate them, which will make them functional. And the moment that hormones will come, prolactin and that kind of stimulating hormone, so they are going to stimulate this alveoli, and this alveoli will start building, start secreting that liquid. And that liquid will start going from that towards the areola. And from here to areola, we have one connection. Every lobule has a connection. And this lobule, we are calling it as a lactiferous duct. So these lactiferous ducts will start, these are the transporting system from that production to that secretion. So now these are the lactiferous ducts. So all the liquid which is going to be formed, secretion which is going to formed, will start moving towards the lactiferous ducts and they will start filling up with that liquid. Okay, so this liquid will now, this lactiferous ducts are again going, and the end point is the areola and then the nipples. So they are all going, you can see in this one that yes, that this is the lactiferous ducts and they are all kind of collected here into the nipples. but the milk will not flow out because nipples requires important hormone so the milk can come outside, and that hormone is a oxytocin hormone. So oxytocin release will not happen into this pregnancy. It is going to happen after the childbirth. So there is no milk release going on. It is only that internal area is functional. Areola is functional. They will start producing the milk. The milk will start collecting into the lactiferous duct and it will stay there. And you can also understand that when the oxytocin will come, so what the oxytocin is going to do, oxytocin is going to directly kind of react over the areola. So this, what is the significance of this blackish part around the breast? It has a significance. What is this actually? It is again a smooth muscle, and this smooth muscle, so this is going to, smooth muscle is going to create a contraction and relaxation. So this kind of movement is going to happen into that. So the moment the areola will contract, there will be compression over this all lactiferous duct. And due to this compression, contractions, whatever liquid is there, it will start coming outside. So it means that this areola is going to be under the effect of oxytocin. So oxytocin is the hormone which is going to create a contraction of the areola. So if oxytocin is not there, areola will not contract. If areola will not contract, milk will not come outside. Okay, and from what is oxytocin hormone? It is a happy hormone. Now, this is going to give us the answer of one question, that if everything is fine after the childbirth, if mother health is fine, baby health is fine, mother is happy. Once the mother is happy, oxytocin release will come. Oxytocin release is going to create a contraction of areola. Areola will contract and milk will start flowing outside. This is a normal lactation process. But if the mother is under stress, might be suddenly she was not expecting C-section and C-section happened. So she's not happy. It might be some distressful situation is going on. Might be the baby is in incubator. So in all these conditions, when mother is not happy, there will be no oxytocin. When there will be no oxytocin, there will be no contraction of this muscle, areolar muscle. When they will not create a contraction, you can understand there will be no liquid come out. So lactation can be affect if the mother is happy or if it is not happy. So this is very important physiology of the mammary gland, and you can go for more detail about that. You can plan lactation webinar. You can understand that lactation counseling. But I don't think so that much of things we should learn. We should just understand the physiology, because this support is given by the nursing care. Everyone has their own experts. If there will be pain and things like that in postnatal phase, I will cover that into that session. Okay. So this is the kind of internal physiology of the breast, and this is what is happening. So this preparation already happened into the first month of the pregnancy itself. Breast will start getting prepared. And even the fat storing capacity will be also there, because we have fat tissue here. They will start secreting more fat. So that's why the size of the breast is going to increase, and that is the largest size female can have. The largest size of the breast female can have is happening during the pregnancy only. Okay. Yeah, we have other, you can understand that other systems, skin is there, some ligaments are also there, suspensory ligament is also there. So this is, yeah, you can go for more detail if you are interested. But for us, it is important to understand what is going on into the breast of a female. And breast changes, increased size of the breast, mark hypertrophy. Why? Because blood supply is very high, skin is going to show you change, elasticity of the skin is going to get more, so it will be more kind of stretch out skin around that area, proliferation of the ducts going on inside due to the hormonal shift coming from the coming from that placenta. Vascularity will be increased. If you see the female breast at particular that time, you will feel this, it is more vascular. That nipple will become more larger, erectile, deeply pigmented also because of the rich blood supply, and they are more functional. The areola will become bigger into size, more darkish into color. So those kind of systemic change, those kind of signs you can see over the breast or mammary gland for female. Okay, so I hope you understood. Milk will not come. Already is ready. Everything is ready, and but milk will not start coming outside because the oxytocin is going to do that work after the child. Next system is the cardiovascular system. into cardiovascular system, that system is also, we need, this is the, blood is everything. We need blood. More blood supplied so the baby can have a nutrition, isn't it? So vascular system is going to expand during the pregnancy due to relaxing and the progesterone hormone. These two hormones are going to relax the cardiovascular system, and due to that, heart rate is going to increase of a female. If you feel that pregnant female, so the heart rate will be 85 beats per minute, as compared to 72 and 75, it will be more than that. More than that. Cardiac output will increase during this in early pregnancy, so you can understand that. And this cardiac output will be increased throughout the pregnancy, and that will be very high even during the labor, when we need more blood towards the uterus, because blood loss is also going on when the baby placenta is discarding placenta. There's no connection between the placenta and the mother body during the childbirth. When the placenta will came outside, there might be blood loss, so this cardiac output will be 50% high during the labor time period. So this is going to this is high. Already the requirement of the body is there. So it will start getting increasing from the 30%, 30%, 40% as per the need of the uterus. It will, the cardiac output will be always keep increasing. So, and you can also understand increased cardiac output means increased into heart rate. So 10 to 20 beats per minute. So it can be 85. So at that particular time period, it can be 90, 95. So that kind of pulse you can always observe in a pregnant female. So very important that when your female is coming to you, and you have to check her pulse. That why it is important, because that is also going to give you kind of thing that how is the cardiac output is very high or not. Okay, we don't want that the uterus is requiring a lot of blood at that particular time, and it's the need of the uterus to utilize the blood, and you are giving her exercise for the upper limb. So we don't have to give her exercise for the upper limb because it is a need of the body. So let that heartbeat settle down. It should be 80, 85. So that much of heartbeat is there. So you can start, you can plan exercise. If the heartbeat is 95, 100, so give her rest. Tell her, no, no, let's rest. Let's just have a breathing. No exercise. So it is very important. No, don't drag the blood away from the uterus, and don't unnecessarily increase that cardiac output. We don't want to kind of put extra pressure over the cardiac muscle. Already they are under the pressure. So keep checking that pulse rate within whenever you. We don't have to give her a high intensity workout, which can increase the shift of that heart rates. Why it is important? Even during the pregnancy, like some of you might be like we are doing a aerobic workout, we are doing dance workout, we are doing some kind of whatever type of workout you are giving to a female. So it is very important that we should check her that we should count that her heart rate, what is the heart rate is going on. It is the simple formula 220 minus the age. So whatever, so for the formula is like if my age is 44, so what should be that heart rate for me? Workout. If I want to do exercise, so it should be simple formula 220 minus the age. So assume that my age is 40, my age is 45. So 220 minus 45 is, it will be 155, yeah, 165. Is it 165? Yes, it will be 165. So that is a highest heart rate. And out of that, we don't, what is the exercise parameter? So it should be, if I'm pregnant, it should be 60% of this, maximum 60% of this, if I'm pregnant. So what is the 60% of 165? It will be around 125, isn't it? So the pregnant female heart rate should not exceed 125. Simple. In my case, if I'm 45 years old. So my heart rate should not exceed 125. If the female is 40 years old, her heart rate should not exceed 128. So in this way, always stay into the kind of safe zone. So always check. So she should have that watch, so she can just keep monitoring the heart rate in between the exercise also. So do not plan exercise when the heart rate can continuously shift up and down. We don't want that. So as a physio, it is very important that don't put extra pressure over the heart, stay in a safer zone, and do not plan exercises which is going to increase the sudden heart rate. Even do not give an exercise into very warm environment or heated environment. There should be enough good ventilation. So this is a very important things when we are talking about the cardiovascular health, taking care of that things. Okay, so be careful all the time when you are planning your exercises with your female. Blood pressure in labor, there will be further increase, yes. And after delivery, everything will come down because that heart will, as per the relaxing hormone, the heart will come back in its normal uh, stage, as well as there will be no dilated veins and arteries. There will be no lot of blood towards the uterus. That will be restricted kind of due to that healing process will start happening in around that uterus. Okay, so cardiac output will be normal after that, after the post-epiphysis period. Another thing is a blood pressure, the systolic and diastolic blood pressure. You can understand that blood pressure is normally this, whatever is there and whatever was her normal blood pressure. It might be the blood pressure was 130 and it was 130/90. So we should be always checking the blood pressure for female. What was her normal and what is happening, what change happened during the pregnancy, and what is the current blood pressure, that status of a female. So blood pressure is lower than the normal in first 2 trimesters, but it will return to the normal into the third trimester. Why? Because there is too much of blood requirement around the uterus. So blood pressure can always can show you some kind of change. It can be low blood pressure in a female, and that low blood pressure can show, that can be the reason of the dizziness and the fainting, because the oxygen level will not reach to every organ of that, even to the brain also. Female can feel lightheadedness also. So it is very important to keep monitoring the blood pressure. As soon as your female is coming, check her vitals, check her BP. If the BP is already down, don't give an exercise. Okay, let her just sit down and have a breathing exercise. So do not give her more stress. Don't start exercise because the blood pressure is already down. So this is again very important things to check. Or so it means as soon as your female comes, you have to see her USG reports. If everything is fine, she's good to go with the exercise. Then check her vitals, check her pulse, check her BP. If everything is okay, then start exercise slowly, mild to moderate exercise, not high intensity exercise. But we will discuss further. But you can understand that this is what is going on. So the cause of the dizziness during the pregnancy is the rising hormonal level, which is going to create a shift into the blood vessels, because blood vessels will be more relaxed and more widened. So blood will start going downward with the faster rate, and it will not come back with the fast rate because the veins are dilated. So venous return will be slower into the pregnant female, because we have this kind of valves present into the veins. So these valves will be relaxed because the vein itself is relaxed. So due to that, this valve will be also relaxed. So the blood will not come up towards the heart. The venous return will be kind of slower down. So very important that we have to give her. So this is giving us another thing here as a physio, that we need to give her circulatory exercise which can help into returning the blood towards the heart. So now what exercise? That calf pumping. Calf is again the second heart. So we have to focus on to more toe curling exercise, ankle toe pumping and calf pumping, that exercise, all the pumping. So the blood can pump back towards the heart. And that can also tell us that try to avoid exercise into standing, more exercise into the standing position, because as per that, gravity will keep pulling it down. We need exercise where it will be easy for the blood to go towards the heart. That positions are good positions to just settle down just to give her a better things. Okay, so it is very important. So yes, ankle toe movements, calf pumping, and as well as the pelvic floor pumping, because pelvic floor muscles are also working as a circulatory muscles, isn't it? They do the compression around the anal region, compressing around that. That is going to create a pull compression over the veins, because there are so many veins into the anal region. So these veins need compression. So that due to the compression, the blood can move back towards the heart. We need that kind of compressive exercise or that kind of the pumping exercise throughout the body, even the pumping of the hands, this kind of wrist movements. So wrist movements are there and the ankle toe movements are there. They are crucial exercise. So breathing are very important. Circulatory exercises are very important. Pumping exercise, which can increase the venous flow, are very important. Any position which can work against that, like, standing position, a lot of pressure over the vena cava. We don't want that. Okay, so this is important to understand for us. So choosing a position. Okay. And dizziness is also caused by low blood sugar level. That may be also happen during this time, because what is going on here is the internal metabolism shift is going on. Body is utilizing a lot of calories and lot of metabolic changes are going on. So her BMR, basal metabolic rate, is higher. So the BMR is not higher because she's involved in some physical activity. She's not involving in any physical activity, though her BMR will be high. Why? Because internal body is doing a lot of work. So her internal metabolic rate will be always high. So keep utilizing more and more energy. So it can be the cause of low blood sugar level into the body. Women who are anemic or who are varicose vein, they will be more susceptible of dizziness. Yes, you can understand that. And during the second trimester, it will be more due to the pressure is going to fall over the blood vessels. So which blood vessel? Vena cava. So because the baby weight is anteriorly, the uterus is anteriorly, so more baby weight will be more pressure. So you can understand, if the female will start sleeping on the supine position, the baby weight is going to fall directly over the blood vessels, bigger blood vessels, and that can cause disease. So we don't want, we have to avoid supine positions for longer than 5 minutes, or there will be sudden shift keep going on in a female body. Very important. Don't apply unnecessary stress. So this is a systemic change happening in the cardiovascular system. So we need a circulatory exercise. So when we need circulatory exercise in first month, second month, third month, fourth month, throughout the pregnancy, we need circulatory exercise. Okay. So whenever your female comes to you, it can be the fourth month, it can be 8th month, always give her circulatory exercise, the exercise which can increase the blood circulation. Okay. Next is a respiratory system change. Tidal volume is going to increase by about 200 ml. So it means the oxygen consumption, the utilization of the oxygen is there by the uterus, and the baby is growing up. So 20% of increase into the oxygen demand normally is going to happen. It can be 20 to 30 also, but approximately it will be 20%. So that because your metabolic rate is very high, the baby is utilizing energy, the blood supply is also there. So the more oxygen demand is there from the uterus. So that that requires better lung capacity. So the respiratory muscles, even which is going to help us into better respiration, they should be very healthy and optimal functional. So that's why preconceptional phase, we should start breathing, giving her breathing training and respiratory training. Teach her all this kind of, pulse breathing, inhale, exhale, this anulom vilom, all these exercises are very, very effective, highly effective, and it is the need of the body just to inhale a lot of oxygen. So inhalation, we have to focus more on to inhale. So inhale and just because it is need of the body, and exhale. So as per that. Okay, so it is very important. Many women complain of feeling short of breath in pregnancy. Even into later stage, it is more happening into starting from the 6th month, 7th month, 8th month, because this uterus is also, one is the capacity is high and tidal volume is increased, and which is the need of the body. And the second is the uterus will start compressing the diaphragm. So due to that, diaphragm cannot functional, this descending, ascending of the diaphragm, contraction, relaxation, which we need for the inhalation. So inhalation will be kind of shallow for the female, because there will be no completely functional diaphragm, abdominal diaphragm, due to the stress which is there over that, the compression which is, this is the diaphragm, the uterus is growing, so it will keep compressing it like this. It will become more dome-shaped diaphragm. So due to the more dome-shaped diaphragm, this kind of restricted diaphragm, it will not be descending down. So descending downward, this kind of movement will be less, and due to that, the thoracic expansion which should happen, the downward and upward, that kind of movement which should happen will not happen in a female body. So it is very important that we train her. Train her body with the good breathing from the starting itself. And also there are so many other exercises which we are going to give her, and the positions which will reduce the pressure from the diaphragm. So that positions are also important. That's why that we are calling it as a pelvic bridging position. So pelvic bridging is okay to go till the time your uterus is not putting pressure on the diaphragm. But this pelvic bridging we cannot do. We should try to give it minimum pelvic bridging, the more progression of the pregnancies into 7th month, 8th month, 9th month, reduce the pelvic bridging. So it is very important. Otherwise, the pelvic bridging is going to shift the baby towards the abdominal diaphragm. So this is very important to understand what is going on inside internally. So we don't want any kind of stiffness, any kind of restrictions to the thoracic cage. Already we know the baby will grow, so there will be kind of restriction to the abdominal cavity. But we don't want the restriction into the thoracic cavity. But yes, it is again the loaded due to the breast size increase. There will be load over the pectoral. There will be even the load from the downward over the diaphragm. So it will be congested thoracic cage, which can affect the breathing pattern of a female and that kind of respiration. So we have to keep this respiration in our mind, and we should give her a good exercise, respiratory exercises. And those kind of relaxation positions, stretches which can relax that pectoral muscle. So the pectoral stretch, so we will discuss about that into further session. So this is a respiratory system change. Now we also understand not only the respiratory, that kind of things are going on, baby is developing excretory system will be also going to change here. So excretory system means the lot of liquid is going to come out as an excretion. So due to that, this renal system will be high, and we are calling it as a that renal systemic change. The increased blood volume and cardiac output during pregnancy causes 50 to 60% increase in renal blood flow. So renal blood flow will increase up to 50 to 60%. And the renal system, the kidneys has to do more filtration, double filtration from both mother and the baby. So double filtration, and due to that, there will be more production of the urine. So you can understand why there's a more urination happening during the pregnancy, and that will start from the first trimester itself, because the growth, more growth, more excretion. Okay, and that excretion is going to do more filtration from the kidney. More filtration means more production of the urine. So that's why our urine are normal. If you say that I'm a normal female, I'm not pregnant, my urination can be 6 to 7 times, 8 times in 24 hours. But in a female who is pregnant, even from the first month, from that first trimester itself, her urination capacity will become double, because you can understand here 50 to 60% increase. So it will be around 10 to 12 times urination in first trimester itself. We can observe that. Okay, so that is also important. And why it is going on? Because internal renal system is changing and more filtration is going on. The smooth muscle of the renal pelvis and the ureters will become relaxed and dilated. Now, renal pelvis means what? This the organ which is going to hold the urine. So, who is that organ? Bladder. So, blood is again an organ. So, that is a kind of, it can, it can expand. It's like a balloon. You can feel that there's a balloon, and that balloon can expand to accommodate 350 to 450, that much of urine. Normally, in my case, in your case, if you are not pregnant. But in a pregnancy stage, this bladder is going to go more relaxed. So relaxing hormone is going to relax the bladder. So the balloon will be more relaxed, more bigger balloon. And the holding capacity of urine will be more. So more collection of the urine will start getting, because the size is increased. So you can understand that the uterus will be, the bladder will be more relaxed. So it can accommodate more urine. And you can, another thing is important here. that we have a ureters. So kidneys are also bigger into size, bladder is also bigger into size. So what is the connection between the two kidneys and with one bladder, isn't it? There's two kidney and one bladder. So the connection between them is the ureters. So you can say that ureters will, it's kind of this will start getting dilated. So it will be more bigger into width. So width as well as the length of the ureters will be bigger. So they will be kind of increase into the size of the ureters, width, length, as well as that dilation. So it will be more relaxed. So it means as soon as the kidneys will do the filtration, it will move downward through the ureters. And these ureters will also become curved. If you know that, let me show you. Just give me a minute. Huh? I want to show you something. Yeah. So this is the kidneys and we have this bladder. You can understand the kidney is going to increase into size and this bladder is also going to increase into the size, and these are the connection between them, ureters. And during the pregnancy, our kidneys are already posterior, and during the pregnancy, there will be baby. Uterus is going to accommodate some space inside the uterus, inside that abdomen. That is going to push the kidneys more posteriorly. It means if I am, these are the two kidneys which is already present on the posterior side. Due to my increase of the uterus size, there will be more posterior shift of the kidney. The moment the kidneys will shift posteriorly, that ureters, they are already attached with them. They will be also shift posteriorly because they are the connections. So this is going to give the curve into the ureters. So they will be more curved. Otherwise, it is this kind of the straight tubes. But during the pregnancy, they will become the curved tube. So into that curved tube, whenever we have a curve, you can understand they will form some kind, they can form some kind of angle. So into that angle, the angles can do kinking. So they will be more susceptible ureters, which can have always some amount of urine inside as per the curving, as per that kinking, isn't it? That can also happen during, not the kinking, as per that curvy natures. There might be more. Urine will start staying inside the ureter. We don't want urine to stay into the ureter. They should just keep coming downward as the catheter tube. But again, it can happen that due to the curve, there might be some urine which can start staying there. Okay, so this is also very important systemic changes which is going to happen with our immune system. Okay, yeah. So bladder smooth muscles will relax, which will increase the capacity of holding the urine. And you can also understand that when this much of relaxed structure is there, the bladder is also relaxed. So we have another thing of the bladder, which we are calling it as the passage of the bladder through which the urine is coming outside. That is a urethra. So this is the female urethra. So this much is the female urethra. So this is the female urethra, and this female urethra is coming out through that pelvic floor. You can see this is urethra, and this is coming out into the vestibule. So this is how it is present. So assume that if the size of this bladder is going to expand due to the relaxing hormone, so due to that, as per the gravity, there will be more compression over downward part. So this urethra will also become relaxed because this is also a smooth muscle. So that will also relax. And in this case, urethra can be visible. Urethral opening can be visible into the vestibule. It should not be visible normally. We cannot see the urethral opening that much visible. It can be just a dot, but this will be more visible due to that more relaxed structure inside and loaded structure, because that is always accommodating more urine, and due to the load, there might be downward displacement over that downward displacement pressure over the urethra, and that can be visible urethral orifice outside. So this systemic change is happening inside the vagina, inside that pelvic cavity, but we can see some more dilation of the urethra as well during the pregnancy. So this is the complete renal system change. kidney size increase, ureters, kidneys will shift backward, ureters will become curvy, more elongated. Downward, we are having bladder that will be more expanding, holding capacity of that will increase. And then you can also understand the urethra, more compression over the urethra and more outside visibility of the urethral opening. So this is all systemic change which is there into the renal system. Okay. Now it is going to give you answer why the urinary frequency of is always high starting from that first trimester of the pregnancy. And that is going to be worsened even after the second trimester. Why? Because on the top of that uh, uterus pressure is there. So uterus is on the top of that. Okay, we know that it is expanding like this, but it is always putting pressure over the bladder. And you can say that when uterus will expand, uterus is going to go all the way up to the xiphoid, this whole organ. So when it will expand up, who will expand? Which wall of the vagina will expand when the uterus is expanding upside? Can you answer me? If uterus is expanding up, so posterior wall of vagina, anterior wall of vagina, or lateral wall of the vagina, which wall will stretch with the uterus? Anyone of you? Which wall will get stretch with the uterus? What do you think? If uterus is expanding upside like this, like this. Anterior wall. Yes, you are right, doctor. It is anterior wall. So more stretching of the anterior wall. So now if anterior wall will be stretched out, upside stretched. So now this is going to, so this is a bladder and this is a posterior wall of the bladder which is going to come in a close relationship with the anterior wall of vagina. So this is the bladder which is already relaxed. So it is staying here. But once this uterus will expand upside, so this anterior wall of vagina will be stretched up. So that will be continuously keep pushing that bladder anteriorly, isn't it? So this, we know that it is relaxed, but it cannot be relaxed because this supportive structure is compressing it. So I am relaxed as per the body's systemic change physiology, but I don't have space because this is keep stretching upside and it is pushing me. So I want to relax, but this is pushing me back. So I will be always, my posture will be always under the pressure. So I can't relax posteriorly. Okay, so that's why there will be restriction in holding the urine. And that's why like I have to go frequently. I can't store urine a lot because my surface from the posterior side is restricted. And who is restricting from anterior side? Pubic symphysis. So we have this pubic bone. Let me just show you. Just be with me. So this is the pelvic cavity, and this is the pubic symphysis. So just behind the pubic symphysis, our bladder is present. So now this is a bone, and bone is pushing me, is again a kind of, it is a bone, not a soft structure which can relax, like our abdominal muscle, they can relax. But this bone cannot relax, it is a fixed. So that's why this apex of the bladder is fixed. So that we know that this bladder is relaxed, but it can store more, but it is stuck by anteriorly with the pubic symphysis bone and posteriorly by the vagina. Vagina is stretched, is keep putting pressure here, keep compressing. And on the top uterus will keep putting me pressure. So I am relaxed, but uterus is pushing me down, vagina is putting me anteriorly, and I'm stuck. So in this way, the surface area of you bladder will be very minimum. It should be high as per relaxing hormone physiological changes, but I will be stuck organ. I can't move anteriorly, posteriorly, as well as superiorly. So where I can move? Only downward. So due to that, the downward displacement of this bladder will be always there. And I as the bladder is the urethra is attached with me, so urethra will be compressed downward, descending downward as per my pressure, and that urethra might be the orifice will be visible outside. Now assume that I am an organ which is present there into that cavity. So automatically you can also understand that when the baby is going to grow bigger size, so the uterus size normally is the weight of the uterus in my body, if I'm not pregnant, is a 50 gram, isn't it? It's only like a apple. That much of weight is there into my uterus, even less than that. But during the pregnancy, when the baby weight will be very high, it will be like a watermelon inside, that much of bigger weight, like a watermelon inside that. So due to that, the weight over will also fall over the pelvic floor. And through the pelvic floor, this bladder is passing, isn't it? And this is supported. This bladder is supported on that pelvic floor, and the urethra is passing through the pelvic floor. But if the pelvic floor will be relaxed, loose due to the load, because you can assume that if you are holding a small apple, or you are holding a watermelon, how much relaxation, elasticity is going to expend into the pelvic floor muscles. So that is going to give weakness to the pelvic floor, and through the pelvic floor only this organ is passing. So if the pelvic floor is strong, good, there will be compression over the completely compression over that, compressive force over the urethra, and it will not let the urethra fall downward, isn't it? Because pelvic floor are strong. But once the pelvic floor is already loose and relaxed, you can understand there will be no holding capacity. Sphincters, closing action around that will be released, not that much of contraction, strong contraction. It will be weaker pelvic floor. So that will not be able to hold, create that compression over that area. And you can also understand what is this organ? This is holding the urine. And already this is a relaxed organ. Urethra is also relaxed. What is urethra? It is behaving as an internal sphincter. Okay, so it is already relaxed. And what is the external sphincter? Muscle. And muscles are also weak. So what will happen now in this case? Leakage of urine. So might be leaking of urine is also very common, and female can even experience more if she has more weak pelvic floor. So now what this statement is telling us, that before conception, we should be giving her strong pelvic floor. So pelvic floor rehabilitation is also a very important part of preconceptional stage when she's trying to conceive. So give her 100% good muscles. If my muscle power will be good, the damage will happen with the stronger muscle. But if muscles are already weak, the damage will happen with the weaker muscle. If the pelvic floor muscles are weak before conception, before pregnancy, this female will have more urine leakage episode. If pelvic floor muscles were strong and we have already taught her, given her training, and she has a good pelvic floor, and the brain is also active, brain will keep activating the pelvic floor throughout the pregnancy also, she might don't have that frequent urine leakage and that frequent issues with that urinary health, urinary system. And there might be, bladder will also not displace downward. Once the pelvic floor muscles are weak, so this is telling us another story or another important part, that training of the pelvic floor should be start from the whenever the female comes to you. If she comes in second month, third month, fourth month, fifth month, pelvic floor training, squeeze the pelvic floor, close, because we don't want opening. Baby is not coming into second month, third month, fourth month, fifth month. So keep contracting, keep activating the pelvic floor and start doing this pelvic floor rehabilitation. Another word, Kegel exercise, squeeze, hold upside. So means close, don't or take a pressure away from that area. Okay, so that's why the gravity, standing position all the time, jumping, standing, cuffing on standing position, avoid that. We don't want to load, we don't want to increase the valsalva, which can put further increase over the pelvic floor, over the pelvic cavity, and pelvic organ pressure can be putting pressure over the pelvic floor and can damage that more weak, it can create more weakness into the pelvic floor. So we have to avoid that factor which can worsen its weakness, and we have to start exercise which can keep activating the muscle, keep activating the closing of the muscle. So instead of descending of pelvic floor, ascending of pelvic floor, and closing around the urethra and around that system, vagina. So just to have a better protection upside. So this squeeze the pelvic floor. So pelvic floor training is also very important. So, so far you understood that urinary incontinence can be common. It will be urinary incontinence, urinary frequency increase can be common. Incontinence or leakage will be happening only onto that female whose pelvic floor was not strong before the conceiving. So those female will have weakness issue. And yes, whose pelvic floor was strong, they can also experience urine leakage due to the relaxing hormone effect into the third trimester. So what do you want to give your female? You want to give her a leakage into starting from the second month, the second trimester, like fourth month, fifth month, she's having leakage, or it is okay if she's having that some episodes into eighth month. So give her a good experience of the pregnancy. So in eighth month, if she's leaking, we can understand because of the weight of the baby and too much of relaxing, weak pelvic floor, this can happen. But it should not happen into the third month and the fourth month, isn't it? So training the pelvic floor is also should be the crucial part of our preconceptional training. But if your female hasn't came to you during that particular stage, she's coming to you during the pregnancy. So start pelvic floor exercise. Squeeze the pelvic floor. Try to hold whatever your capacity is, relax and keep doing it throughout the day. So can I do Kegel exercise anytime, even in a standing position? You know, sometimes it is saying, some people are saying that you can do anytime in any position. If you are standing, if you are cooking, you can do Kegel exercise anytime. But no, this is the wrong statement. We should not do the Kegel exercise anytime if our pelvic floor is already vulnerable during the pregnancy. Already there is a weight over the pelvic floor from the pelvic cavity, from the uterus. So in this case, we should avoid doing the Kegel exercise into standing position or sitting position, because in sitting position also, the weight is going on downward, isn't it? Gravity, as per the gravity, weight is going downward. So remove the gravity. So always doing Kegel exercise are effective if your muscles are weak. Already they are weak. So do the Kegel exercise in lying position, lying down position, elimination of the gravity. It can be lying down, it can be the prone, it can be sideline position, but no gravity. Okay, gravity eliminating positions. That are the best positions to do pelvic floor contractions if your pelvic floor is already weak. Yeah, if your pelvic floor is strong, you are a strong female, you don't have any issue, the pelvic floor health is, pelvic floor muscles are also very good, then you can do Kegel exercise in any position, standing, because in this way you are activating the muscle. You are just telling your brain that I have these muscles and I have to keep utilizing these muscles. There's a different story. But in this story, when already she is pregnant and already there's a load, so don't apply, don't give her that position to do the contraction. Assume that you are sitting like this and you are contracting pelvic floor. So there's already load over your pelvic floor, isn't it, into this position? So no, this is not the best position to give Kegel. So better is a lying down. It can be sideline position, quadruped position, elimination. So breathing exercises, Kegel exercises, circulatory exercises, they are important exercise which we have to give our feet. All right. Do you want to have a break of 5 minutes or 2 minutes? 2 minutes. Because the content is huge. I want to finish first trimester today. Yeah. What is the cause of urinary bladder prolapse or uterus prolapse? The cause of this is a weaker pelvic floor. Now you can understand weakness into the pelvic floor. Pelvic floor during the childbirth, during the pregnancy, already stretching, and the pelvic floor muscles, they are the muscles, skeletal muscle. They can heal. Relaxing hormone can heal them after the postnatal phase, but relaxing hormone or any hormone cannot increase the strengthening. For strengthening, they have to go for a rehab, pelvic floor rehab or physiotherapy rehab is necessary. But not all the, like how many of the female that they are going for the pelvic floor rehabilitation after postnatal. So muscle healing is a natural process, but strengthening is not a natural process. It is a process given by the trained physiotherapist who can help you to increase the strength back. But 100% of the female, they are not getting pelvic floor rehabilitation. in their life. That's why their muscles are always weak. And due to that, descended muscle as per the gravity, because we are functional. We are always doing our activity on the standing position. So gravity keep pulling our pelvic floor like this. Pelvic floor is a transversely situated muscle. So it will become more weaker, 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 isn't it? And that is the cause of the descending of pelvic floor muscle. The moment the pelvic floor will descend, the organs will start descending, isn't it? Because they're also already on the, they're situated on that. So this is an organ, this is my muscle. If they're ascending muscle or descending, the moment it is descending, the organ will also start descending. The moment it will start, organ will start descending, organs are attached inside the pelvic cavity with the ligament. I'm an organ, I have my ligaments, which is there. So I'm supported there by some ligaments, anterior ligament with the pubic symphysis, posterior ligament. You might have heard about round ligament, broad ligament. So these are the ligaments which is holding the uterus anteriorly, uterosacral ligament posteriorly. So these are the ligaments. So the moment the organ will descend, there will be continuous stretch over the ligament, and the ligaments will become weak. And this is they will not pull the organ up, because due to the downwards descending pressure all the time, there will be stretching, continuous stretching over the ligament, and that is the reason of the prolapse. Okay, Dr. Pramina. So it is very important. Strong floor. Squeeze the pelvic floor, ascending pressure, no downward displacement, no pressure over the ligament. So what is important here? Reduce the gravity. Don't always stand and do the work. Please sit down and do the work. Okay, so let's have a break of 2 minutes. It is 21:52 in my watch. So I'll see you within 21:55. Take care. Bye.